Welcome everyone to this week's Social Justice Research Seminar. This week we have a joint presentation from three presenters, actually. It's going to be Sara Schwartz, Jen Parga, and Isabella Villanueva, and they will be talking about pocket practice effects of a motivational interviewing simulation smartphone app on MSW student confidence. So for those of you who are into technology for social good and technology for social work stuff, this will be a treat. So I'm personally looking forward to it. So take it away.
Awesome. Thank you so much. And thanks for coming online. I'm trying to figure out where to look. I think it's here. But thank you for coming. We're really excited to be here. I definitely wanted to just thank Sara. Always is like my unofficial like mentor in terms of like evaluation and research, and always she's a yes woman. So I'm always like, what do you think about this? And she's like, yes. So I just appreciate that. And Isabella actually turned out to be very similar, because we said, Isabella, what do you think about doing this? And she said, no problem. I'll talk to a faculty member and I'll get back to you. And she did, and she's amazing. So I just wanted to start off with that, because this project wouldn't be the same without the two of them. Oh yes, here we are. This was from graduation last year, which Isabella's also graduating soon too. So we want to celebrate her this year. It'll be very exciting. So talk a little bit about what simulation is. We'll talk about motivational interviewing, the training that we're already doing at USC. We'll talk about the partnership between the University of Utah and USC, Suzanne Dworak-Peck School of Social Work. Sara will get into the methodology, and then Isabella will talk about the statistical analysis and the results. And then, of course, we're happy to chat with you all in terms of any questions or future implications for social work. Okay, so what is simulation? So it's interesting in terms of MSW training. We do a lot of experiential learning already in practicum. And so the idea with simulation is to create a real lifelike scenario that's low risk. And so there's two types of simulation that you can do, computer-based or human-based. And social workers, as you know, if there's any clinicians in here, we have been doing role playing for a long time. I can't say we because I'm a macro, but clinical social workers have been doing role playing for a long time. So that's already built in our curriculum. The experiential learning process begins with that role play or actor, if you wanted to also utilize that simulation. But the experiential learning is followed by feedback, and that can be from your peers, that can be from another faculty member, or for some cases for our students, they get feedback from their practicum instructor. The final piece of the experiential learning is that student self-reflection, and that can be on their own within a group, but it usually kind of all happens at the same time or within that grouping. The next part is who's using simulation-based training, and it really should be who is not using simulation-based training. I want to say social work is the last, but I don't know that for certain. But we are very slow to adopt technology. But if we're counting role play, maybe we were first. I don't know. But city planners are using simulation, first responders, doctors, nurses, pilots, automotive engineers, and then finally social workers. And specific to social work, some examples of where simulations already being used can be seen in crisis intervention, child welfare. Specifically, I know DCFS already does simulated home visits, mental health counseling, substance use, and then older adults. And we are going to focus on the mental health counseling piece of the simulation. And we actually have both kinds of human-based role play and actor happening here at USC. So I wanted to talk about what we have already. And as a practicum faculty member, I've also been the course lead for Social Work 591 for VAC. And so I want to just point out two of the different ways that we do our motivational interviewing training, because this is very critical for the results that Isabel will talk about later. So on campus, our students receive motivational interviewing training the week prior to their semester starting. It's in person, it's 4 hours, it's a specific training, there's a manual, there's designated activities that Betsy Phillips and John Brecky put together. It's amazing. If I could say that. Ongoing practice is done in the classroom with their peers through role play and is as time permits. So if a faculty member gets time to practice motivational interviewing with their students, they can. If they don't, they don't. The feedback that they get is from their faculty or peers in the class, and then the documentation piece, the reflection that we're hoping that happens in that experiential learning is through their reflective learning tools and or progress notes. To the right side, you'll see the Virtual Academic Center, which is where students take their courses online. Their motivational interviewing training occurs during the first 5 weeks of the semester over the course of weekly lessons in class. It's the same manual, same activities, and yeah, same manual, same activities. But their practice is ongoing from weeks 1 through 15. The practice that they receive is a simulated client, which is played by an actor that has a script. So each classroom has the same script, the same Mario. Sometimes there's this one actor that will have like 4 or 5 sections, and then another actor that will have a few more sections. And they do this practice, motivational interviewing practice, from weeks 3 through 12. They also receive feedback in real time, and then they have the same documentation as on campus, which is the reflective learning tools and the progress notes. Okay. The other piece, so once I was the lead for Social Work 591 and recognized that we worked with our on-campus 591 leads as well to make sure everything was the same. Make sure the programming was the same. It's just delivered in a different methodology or has different learners in the classroom. But what I realized is that they were different, and it wasn't different content, but just the way in that it was delivered. And so I started looking to see what's out there, what are other schools doing, and came across the University of Utah, and they had actually already talked with USC a couple years ago. But they have launched what's called their virtual social work trainer program, and they have 2 products. So one is their virtual reality, which simulates a home visit. So students can put on the virtual reality goggles and go through and do a risk assessment within a home. You can look in different bedrooms, you can open the fridge, you can check and see what type of risks would be present in that house. The other one that they have is their virtual motivational interviewing training app. And so this, we'll call it VMI moving forward, but this VMI is a phone-based app, and it's designed to teach and provide simulated practice opportunities to build motivational interviewing skills. The goal of developing this app, or the intended result, was so that students would have, or social work professionals could have a supplemental tool. It wasn't intended to be the primary source of training. And so once we learned that, this is when this partnership kind of felt like it could be a potential opportunity for program evaluation. They do also, within the app, have 15 skill-based modules. They have repeated practice opportunities. Students can log in, create their own login, go in, save, or not save, but repeat different modules, or if they learned something in class that day, they can go to module 5 or 9. They don't have to go through it incrementally. And then they also receive immediate feedback from the VMI coach or chatbot within the app. We did want to share just some of the modules, examples of the modules that are there. And for those of you, maybe students that have received the motivational interviewing training, you'll see a lot of the language that we use in terms of building rapport, open-ended questions. Summaries, affirmations, double-sided questions, things like that. And so these are all of the areas that are focused in the app. And now Sarah will talk about the methodology.
Jen, I'd like to thank you for bringing us together to thank us. Jen always has great ideas that she invites me to partner with her on. So this has been really fun. So we, as a team of two, decided to pilot test this app in the fall semester. We actually were able to do a 4-arm quasi-experimental design, pre-test, post-test. We had campus-based 4 sections of our campus-based class, 591, use the VMI, 4 sections decide or opt out of the VMI. We gave instructors permission. So, and 17 out of 19 instructors agreed to participate in this study. And then on the VAC, we had 5 sections use the VMI and 5 sections have the traditional 591 education. Did I skip a slide? No. Okay. So we did pre-test, post-test. We used a Qualtrics survey. The app creators had a few questions they wanted us to ask. We asked some demographic questions of participants, and then we found a motivational interviewing confidence scale that we'll talk about in a minute, but it was created in 2021 for a research study. And so we got permission from Larson and Martin to use it in our study. We also collected some open-ended qualitative data on user experience and satisfaction. And then at the end of the fall semester, we conducted a focus group with the instructors who adopted the app last semester. Here's the article we found for the motivational interviewing scale that we used. And just some background on this. A large university in Midwest US. They were doing an evaluation of a 2-credit motivational interviewing training for interprofessional health students. So there were some in pharmacy, not necessarily specific to social work, but it was kind of a interprofessional degree program. And they couldn't find a measurement tool to look at how the skills they learned in the training were adopted in practice. So the authors designed this tool to measure student confidence. It's 24 items using a 10-point scale that ranges from cannot do it all to highly certain that I can do it. Has a high internal consistency reliability at 0.98 Cronbach's alpha. Couldn't find test retest reliability or anything on validity. The authors really were excited for us to use their measurement tools, so we can perhaps, that will be in our discussion section, run some psychometrics on it. So here are just some example or the questions from the scale. You know, remember on the 10-point Likert scale, how comfortable are you that number 10, you are able to invite the client to talk about and explore his, her, or their own ideas for change. We can share these slides if anyone's interested. Seeing them. Oh, I guess that's about it. Okay. Isabella will discuss the analysis process.
All right. Thank you so much to Jen and Dr. Schwartz. I really appreciated you guys taking me onto this project, and I had a lot of fun. So hello, everyone. I'm a student worker with the social work school, and I had the honor of statistically analyzing the survey data that was given to the students within all of the different sections. So here on this slide is a visualization of what it took to make the population number of 114 paired cases. There were originally a lot more within the pre-test data than the post-test data. And that is simply because different groups were given not rigorous standards on how to take the survey, or they didn't complete it. They probably duplicated it multiple times, and that may be an error on Qualtrics. You may start a survey and not finish it, and that gets submitted to our total collection. So how I was able to clean up the data was just alphabetize each pre-test and post-test data, which is kind of visualized in the left side. And after ordering each of the 2 tests, I was able to match each case by their external ID, or the first 3 letters of their first name and first 3 letters of their last name, just so that we can anonymously collect survey data, but without also having a unique identifier to be able to match these cases, because that was something that we didn't think about until pretty later, but I'm glad that we had the external ID to match the data. Different demographics like the gender and ethnicity and age was also helpful, especially if there were duplicates of names. So after matching all the data, seeing which cases finish both the pre-test and the post-test, the ones without a match were censored. And then those who did not complete both surveys entirely, i.e. not completing the motivational interviewing questions, all 24 of them, they were also censored. And those with duplicates of their surveys were also censored as well. And you can go to the next slide.
Okay, I also just want to add, I forgot to mention, we had a $50 incentive for every class using the VMI. So we did have duplicates, I think, people wanting that gift card.
Oh, for
You know,
sure.
yeah.
All right, so this slide is just giving homage to the Larson and Martin article of 2021 that was helped us formulate our statistical analysis. And this is the original survey that we used to model our results for the social work students. And originally, just like the original article, we had our survey given from the scale of 0 to 10. And just like the article we were referencing, we also changed that range from 1 to 11 to reflect a more accurate average score for each question. And we were able to replicate it pretty similarly. And on the next slide, I'll be able to show you the significance of each of the questions, as well as the difference between means. Oh, maybe after that, next slide. But this slide is just talking about how we classified the VMI status. We had a bunch of sections, and they were sorted versus comparing if they were on ground or on campus, or if they were online. And we were also comparing if they were using the VMI app or if they were not. And based off the section number and the course instructor, we were able to match who was in the VMI and which type of campus that they were on, to be able to categorize them into different groups. And that helped us with our statistical analysis of who saw the most improvement over the course of a semester using the technology and who didn't use the technology. Comparing those with the categorized groups helped us a lot, being able to know who was really impacted and if the app really made a difference, as we were hypothesizing. If the participants' surveys indicated that they were in a different section prior and their post-test said something else, they were also censored, just to add to the validity of our data, making sure that the people that were reporting the survey was correct and accurate. So you can go to the next slide. So using the 114 perfectly matched data, we had 114 students pre and post, so in total 228 cases to analyze. We see that the pre-survey mean for the dark green saw the largest improvement, and the gray saw a moderate improvement, while the gradient of green just shows the strength of improvement compared to the motivational interviewing questions. Specific topics were probably analyzed more. That would be something we would like to continue to look into, of what our course curriculum really targets, and maybe we can see a larger improvement with all of the questions if we refine and replicate this. But we see that a lot of the questions, all 24 of them, have a pretty significant p-value as indicated by the less than 0.001 p-value. And then I included standard deviation, the 95% confidence interval, the lower and upper confidence intervals, as well as the standard error mean, just for those looking at the statistics as well for these different questions. Go to the next slide. And finally, these are our results. Looking at the VMI groups and the non-VMI, as well as the online and on-campus, we can see that in order, the largest pre and post difference was group 3, the online group that was not using the VMI. And then it goes down progressively in order, and surprisingly, those with on-campus with no VMI had the least amount of difference between their pre and post tests of average scores. So this results is just visualizing the average scores of each group that show the general confidence before and after the semester. And as I already said, group 3 improved the most, and group 4 improved, or group 1 improved the least. And in each survey, there was student feedback about the app, and a lot of feedback attributed the app's interface and the lack of user friendliness for their displeasure with the app. And I think that could be refined later on by the app developers, which is why we did this test in the first place. Thank you.
Okay, thank you, Isabella. So this wasn't what we expected to find, but our MSW students were disgruntled with some aspects of the app that we shared with the developers, and they had actually received the same feedback from other tests. So they have revised the app, and we are in the process of designing a repeat study for this fall with the revised app. I don't know if you want to come up and talk about in a minute some of the implications for practicum education.
I can talk more about what they said.
Okay.
The app, I think, so we're the first school to actually compare or look at their app consistently through multiple courses. They were working with Long Beach in the summer, and we wanted to be first, so we wanted
to be Tori.
we wanted to be Tori.
Yeah.
But their Long Beach students also shared very similar feedback about the app in terms of they wanted it to be more gamified. It's like you have a conversation, you type in your response, or you hit select a response, and based on that response, you get another response. So they wanted it to be more like Duolingo, or something that gives you a badge when you pass a certain level, or sends you a reminder, or something that's more interactive and engaging versus I have to log in to do this thing. That was some of their feedback.
So we do have a meeting scheduled, right, to prepare for a fall 2025
Yeah.
pilot. And we are thinking about the working professionals program as well. I would like clearly to assess the psychometric properties in the social work sample. I thought this would be a good place to see if there are PhD students who want to get involved in our project, do some reliability and validity testing on our existing data or our fall 2025 data. It's just a good opportunity for publications and presentations.
Mm-hmm. I think one of the things, especially from the practicum standpoint, we are always looking at the different ways that we deliver our programming, whether it's for on-campus students or our students that take their coursework online. And also curious if the method of receiving training over the course of several weeks with a simulated client versus being in your practicum with actual clients would impact the self-confidence level in either way. And I think there's been some question of, well, it's not a real client, so how could it, create that same outcome or confidence when it's not real versus something in real life where you are there and you're present, you're in the moment and you're in front of somebody. And I think this demonstrates that the model that we utilize in our online programming for our students that are taking their coursework online with the actor over the longer course of time and practicing and receiving feedback in real time creates more confidence in our students than receiving the training in one block and then going out and using it on their own. So some implications, I think, for practicum is to really consider, do we do that across the board? That same model, do we wait for the results of the second study to see if the app has improved? Yeah, I know, practicum is very interesting in terms of the impact. These are our references.
I guess
That's it.
yeah, cute. Yeah. Does anyone have questions?
Is the app using a generative AI as a response, or is it more of a structured if and response?
Structured. Yeah. I think I said chatbot earlier, I misspoke.
Well, structure
I mean,
can be a chatbot.
yeah,
It's
like-
just, we start to think about them as being much fancier.
Right, now it's fancier, so,
I guess I have a comment and I have a question. So the comment is, I'm glad that you are working with the app developers with the feedback that you got from the students. I'm actually in the middle of writing a paper right now about how to do AI-driven intervention design. And the thing that we talk about a lot in this paper is just how important this community feedback is. And we actually talk about what we call as critical moments of retreat, which I think is what you guys are facing here, this app designer is now facing, which is like, you do this, you think you've answered the question that's been asked of you by engaging community partners in some regards, and then you get them the thing that you think that they asked for, and then they say, no, this is actually not what we asked for. We want something a little bit different, or once you put this in front of them, then they're able to better articulate what it is that they want. And I think that this is a great thing for, app designers, but also those of us who are thinking about sort of using this kind of technology in the context of our education or research, to just be mindful of the fact that it's not a straight path and like, oh, you're a smart person, so you came up with a great idea for a technology solution and then it's going to work. I mean, it might, usually in my experience, flops first, and in some way, right? So, it's, glad that you're not just giving up that, oh, well, we didn't get the results we thought we would, we thought it was going to, and that you're going to keep going.
Yeah.
The other thing that I'm curious about is, could you go back to the comparison between the group slide? I'm just so I can kind of get a better sense of which group was like, yeah. So it seems like your online folks, so everybody starts off more or less the same, which is good. And then the online folks seem to get a little bit more confident than the on-campus folks, but the folks that were doing it with but then you have sort of a flip-flop with the VMI thing, right? The on-campus folks seem to like that, but the online folks did. Do you not do the actor thing for the on-ground? Oh, so it's just people being role-playing with each other kind of thing? Oh. Yeah, just because you're a good MSW student doesn't mean you're a good actor.
what do you mean?
I know.
No, but you are pointing something out there. The other thing I was thinking with group 2 and group 1
Yeah.
is that group 2 received an additional something, an additional support, kind of a nod to the pocket practice, right? They could go back to it whenever they wanted to.
Yeah.
They could, outside of class, when they were receiving formal training or peer feedback, they could go to the app and say, what is a double-sided reflection again? I can't remember. And so that might, you know, be the next best for on campus in terms of something that is supplemental to support their increased confidence.
Yeah, well, and also with the small sample size, like, I mean, you know, are group 2 and group 4 actually different? And are they actually different from group 3? I mean, it seems probably reasonable that 3 and 1 are different, but the other ones might be, because I mean, all you're doing is rank ordering the pre-post differences. The statistical significance you reported was a pre-post within group, not between groups. So you don't know yet if there's a statistically significant difference between the conditions. Or at least you haven't tested that.
Yeah.
You could test it, you should test it.
Isabella, did you hear that? No.
No shade, no shade. It's just like, it's possible to look at it and you should, because it's, and sometimes, you know, since these 4 groups are actually pretty different, it also makes me think you might want to pick, you know, whatever is the most traditional thing to be the contrast and then compare everybody to that, as opposed to trying to somehow do some, you know, really wacky set of, you know, a bunch of different pairwise. It's just like, okay, well, maybe on campus, no VMI is the standard.
Right.
And let's compare everybody else. Is it doing better than that somehow? Or
Okay.
different than that somehow?
Yeah.
I mean, you could also do the pairwise comparisons between 2 and 4 and see if that's actually a meaningful thing, which would suggest that, as you're suggesting, Jen, that maybe VMI is better than nothing, even though it's not as good as the actor session, which seem to be the ones that really are putting people feeling good about their skills. But I don't know, there's probably other people that have questions. So I'll
Yeah.
stop.
And just pro.
Ruth?
So hi, yeah, this was great. You know, I find this just fascinating and you know, I'm big fan of the virtual practicum and have taught it a couple of times. And I think there's some differences between that kind of make sense in terms of, you know, when you go into a placement on campus, they're going into a placement and really they get whatever happens in the practicum agency. Right? Whatever the agency decides to do, the practicum instructor may or may not be skilled or knowledgeable about motivational interviewing. And they're often not observed. They're often not observed by peers and they're not video recorded. Whereas on the virtual practicum, they're video recorded. They go back and watch recordings of themselves. They actually see themselves progress. So they can tell. And then they have their peers watch them and give them feedback, which I think, as nerve-wracking as that is, the first class or two, after a while, that's what helps, I think, with the confidence. So I think there's some intrinsic things about the virtual practicum that helps to get to, you know, that people feel more confident. I don't know whether how the VMI plays in with that. But I also would be curious then also to see what it's like at the end of the 4 semesters, because I know in the past we've looked at student learning outcomes and found they've been very good with the virtual practicum, and then they kind of better than on campus in the first semester, but then they've kind of come together to the same place by the end of the 4th semester. So
Yeah.
Anyway, great research. I'm really glad I was able to jump in and hear this and you know, some of your suggestions, what we can think about doing. You know, there's some challenges to offering the virtual practicum on campus, and you talk about the working professionals, and we've done that before, and you know, it's often the grass is always greener. Like the people that are in placement think it'd be better to do the virtual practicum, and the people on virtual practicum think it'd be better to be in placement. So so those are some challenges, but obviously something we'll talk about more in the practicum with the practicum faculty. So thank you for doing the research. I look forward to hearing more.
Dave, did you have a question or comment?
There's someone in the chat.
Oh, maybe it was there was somebody in the chat.
I have a question.
Yeah.
At the beginning, you said that there's a 4-day seminar and then the on the ground. Can you clarify when do they get to practice?
So the on-campus students have a 1-day, 4-hour training on motivational interviewing. And their practice happens during the 4 hours. And then in their social work 591 class, as not permitted, but as it can occur by the faculty teaching it.
Which one's 591, sorry?
Sorry, it's the first practicum advanced or practicum course. Yeah, practicum.
And the online training that's doing so well, what, could you remind me what that's all about again?
Yeah, so they receive motivational interviewing training, same manual, but the contents are spread out over a few weeks, up to 5. So like some faculty might take 2 weeks, some might take 3, some might take 4. There's not a set standard for that, but it's how you get through the material. So I know for myself in the virtual one, or online course, like if I have a student or a few students that are struggling on a certain concept, we'll kind of hang out there for a little bit and keep practicing, go out in breakout groups and come back. And then when they feel ready to move forward to the next one, then we move on to the next skill.
Where does the actor part of it come into that?
So on the 3rd week, after they've received 1 to maybe 4 to 5 training sessions in their class, because they meet twice a week, the actor comes in for 1 hour, and typically half the class serves as the counselor and the other half serve as coaches or provide feedback or tips or help in the chat box. But they each get like 15 minutes.
And those actors don't go to the in-person trainings?
Correct.
So you've got 2 variables at play, right? It could be, so it sounds like, is it actors versus social work students that are doing the role playing?
Sure.
Is one factor, but then the other factor is do it at one time for 4 hours versus doing it broken up into smaller sections over the course of several weeks. And I mean, it sounds like implicitly your hypothesis is that it's the breaking it up over time and having the ability to sort of reiterate difficult concepts that's probably driving this more so than the difference in who's doing the role playing.
Right.
And
Or using the app.
Right, and Ruth
Right.
Ruth has commented on here that for the ground students, it depends on what's happening at their practicum.
Right.
Right.
You know,
They might not get clients.
Yeah, and then Linda, who's an MSW student, said last semester our base was MI and we built other practices on top of it, but MI was practiced each week, and she's a BAC student.
Okay. Yes. That would be true.
Were you able to record the amount of time if they had?
Yeah.
practicum?
Great. On the app or?
Or either?
Okay,
Yes.
so we required that, or we requested
Yeah.
that students do at least 30 minutes a week in their own time. We didn't want to have the VMI take up class time for the faculty's sake, like there's already enough to do. But that if they could give reminders, and we're actually waiting on the data from Utah to see what the actual breakdown was in terms of usage. So we do have that number coming.
So I think that's a question.
Yeah. Dr. Hilbert?
Yeah, just a question about sort of how the degree to which students have opportunities. I don't have the list in front of me of all the various skills. Some of them seem pretty like generic, kind of basic, good clinical reflective practice kind of skills, and some of them are more specialized to MI. And I wondered, yeah, that's the degree to which you feel that students kind of have opportunities to practice a lot of these things already as part of their practice experience, kind of the basic skills like small talk and open-ended questions. And my guess is that most students probably have a lot of opportunities for this kind of activity as part of their practicum experience. Is that a fair?
It is if they have clients in their first semester.
Okay.
And so it depends on the agency. Some agencies give you clients the first week or have you shadow. Other agencies might wait a full semester or only have you shadow for the first semester. So they might not have any practice personally. They may see it from other clinicians or be doing case management where they would still use MI. Yeah, I don't know if that answers your.
Well, the reason why I'm asking the question is kind of a couple reasons. One is just simply doing things right often enhances people's confidence which is the sort of the primary measure here. So kind of thinking about the realistic motion that can be made just by the addition of an app on top of what is likely a lot of other practice activity that occurs both in the classroom and in the practice environment. It seems to me, and maybe I'm wondering whether it might at all make sense to kind of pick out those skills that are more specialized to MI, right? That folks might not have as many opportunities to likely have as many opportunities to practice in standard first semester environments, to see whether if you just kind of went through the list without looking at what the results were and said these like double-sided reflections, right? Whether you pick out the things that are more unusual in their character and less kind of standard basic clinical practice, whether those might happen to show any more of a difference. When I look at your group kind of different slides, although there are differences by group, I do have a question from a statistical standpoint. I think Eric's already raised this. I wouldn't be surprised if those differences between the groups are not statistically significant. But I wonder whether if you look at those skills that are maybe more sensitive to not having practice opportunities, whether they might show a larger difference. That's kind of where I was going.
Do students ever submit a sample and then it gets like MIT coded? Or no?
I don't know.
And then like each utterance can be given, oh, this is consistent with MI, it's a double-sided reflection.
Yes,
This is conveyed.
that's on the reflective learning tool.
And do they get that score, or how do they get feedback?
The faculty member reviews all of them, all of the dialogue. They get it after the session from their peers, and then also in their written reflective learning tool. The dialogue, there's dialogue line by line. I've also looked at, it sounds like in terms of like more techie ways of doing that, like voice thread and things like that, where you can actually have AI recognize it for you, like, and do it that way. But we like paper, and we do the RLTs. Yeah.
Well, if there's a doctoral student, not SPSS or SAS, who wants to really dive, take a deep dive into it, we have the data, some data.
Great. I just John Bunny, doctoral student, he's interested.
Oh,
So you got to take her. It's I was gonna say, I saw John was online, and he's a gung ho about technology and mental health stuff. So I'm sure that I'm not surprised that he's interested. I wanted is anyone has any last questions? I think we've got time for like one more, but it'd have to be very quick. All right, in that case, then, thank you for such a great talk. And I just want to say as a parting note, it was really cool to have rigorous research done about teaching innovation. I mean, it's not something that we usually do. I mean, we're usually a bit more focused on, community-based research and these sorts of things. And it's nice to actually remember that we can also research the things that we teach and how we can teach better, and especially the role, is an innovation just because it's new doesn't mean it's actually an improvement. And this is a nice bit of, sort of reality testing of, what's happening, working well, and needing refinement. So very cool stuff. So thanks a lot.
thank you for
Yeah.
having us.